is Jesse. Like Brian said, I am a registered nurse. I work in the ICU. I work on a COVID unit. To paint the picture a little bit of what my daily routine is I'm working on a floor. Normally, I would work on an ICU unit that's 18 beds. Unfortunately, our facility only has one ICU, and 18 beds is just not sufficient for what we predicted a surge of COVID patients would look like. So we moved to a mixture of a step-down ICU to a med-surg unit, which has like 35 beds or so. And we basically built it an ICU from scratch, from the ground up. We started doing that in the middle of March is when we had our first COVID patient that tested positive. And he actually was discharged yesterday for the first time. That was our first COVID patient being discharged. So that was a huge success for us. But in the meantime, we had a number of patients that passed away due to this insidious virus. My daily routine is, getting a report and going in my patient's room. And I found that a normal ICU patient on a normal day, I could go in and out of my ICU room freely, going to the bathroom, looking at orders, getting my meds, taking coffee breaks. With this pandemic, it's put extra stress on our nursing staff. I'm in my patient's room anywhere from minutes to up to like 5 hours at a time without leaving, going to bathroom, eating, drinking. At first, it was really intense. We had a lot of sick patients really quickly intubated, and the progression of their disease process, I just had never seen that progress so fastly before, from being on a couple liters of oxygen to intubated to proning them and which means flipping them on their stomach so they perfuse their oxygen better. And it's just, I'm really happy with the staff that we have, from the doctors to the nurses to the RTs. We've been an excellent team, and I hope we've positively impacted a lot of our patients as best we could. We hear the horror stories in New York, and it's just eye-opening and frightening. And when I'm in the room with these patients, that is things that I think about sometimes. I have a capper helmet on. A lot of people talk about the N95 masks. At the VA, we're fortunate enough to have these capper helmets on that are like a space helmet kind of. And unfortunately, they're heavy, and they give you a little headache after a while, and your neck hurts. But you're in your room and you feel safe as you can be, I guess. But there's always that thought of this guy has that virus that you hear on TV and on the news, and it's frightening when you see the pictures in New York and Italy and Spain and stuff. So I just today is the start of Nurses Week, and I think I've seen a lot, and we hear a lot of people on social media calling us heroes and giving us thanks, and we all appreciate that. But what we really would appreciate more is for the medical facilities throughout Milwaukee, throughout this country, to get on board and offer healthcare workers hazard pay. All essential workers should get hazard pay for this. ICU nurses in the COVID rooms, any nurses in the COVID room should have their scrubs laundered by the facility. We're asked to take our scrubs home with us. We're trying to mitigate the spread of this disease, and yet we're bringing our soiled scrubs into the communities back home. That's irresponsible. I think hazard pay, scrubs, pay time off for when we get sick. I mean, I'm risking my life and my health to care for these patients that have this infection and virus, and I'm more likely to bring it home than people that I know, like my neighbors and stuff, to my loved ones, to my wife and my son. And that's nerve-wracking, and that puts a lot of extra stress on healthcare workers. Childcare, a lot of us are married to other healthcare workers, and we're juggling care for our children. And medical facilities, they should be supporting us and providing healthcare, childcare for our children. I think orders like stay at home are important to help mitigate the spread of this disease. We've seen, in the last couple of weeks that the we've had a decrease of COVID patients being admitted onto our units. However, we're still seeing like really sick ones. Over this weekend, we've intubated a number of them, and it's really rough, and it's really frustrating when people give us high fives and thumbs up, but then go protest and say that they want to get their hair cut and go to the bar and stuff. And that it's kind of a slap in the face and a stab to the back of a healthcare worker. I think staying at home orders should be, strongly advised. And I advise everyone to, social distance and stay at home and just protect their loved ones and the community. And, together we can get through this. This is affecting all of us. And I know it's stressful for myself and my wife and my family too. But I just really want to stress, I also see, and my concerns are the information that's spread on social media. A lot of people I find are spreading advice that are not the advice that a healthcare provider would spread to or suggest. And whoever's listening, I hope you're taking medical advice from medical professionals regarding COVID. And I just want to say thank you for anyone who's reaches out to the nurses and supports us. And I hope we get through this sooner than later.